Okay, Dr. Ridwan Mia, plastic and reconstructive surgeon. I think it's important that people appreciate their beauty, their inner beauty as well as their outer beauty, that they must respect and appreciate everything about themselves. And the outer beauty is often an indication of what lies inside, of what that person actually thinks of themselves. I think it's very important that the person expresses that which they feel and that which they think of themselves in terms of. I think students in South Africa, many of them are inclined towards professions like medicine. And then too, because of the nature of the way media has turned, particularly in the last few years, we get exposure to overseas documentaries on medical matters and including aesthetic surgery. Students have been more inclined towards these kinds of professions than ever before. And I think it's for us to nurture that, to encourage them in that direction because the market in that direction is growing. And also on top of it, in terms of seeking out care for themselves. So we see many medical students and many other university students who become conscientized towards things like scars that they've got from previous injuries, towards abnormalities they perhaps were born with, or perhaps other congenital defects that had happened, before. And it's for us to reconstruct those areas or to advise them about what can be done. And we often invite students from that point of view to come and observe the work we do in hospital, but also just to come and sit and chat to people in the profession and to get some idea of what's important, what can be done, what can't be done, what's reasonable, and many times we find ourselves surprising students because we are showing them what is possible, things that were thought of as not necessarily doable. Sure. We have many male patients that come to our practice. They are looking for operations to reconstruct defects that they were perhaps born with that affect the head and neck area, that affect the hands, for example. We also get young male patients coming to seek cosmetics operations. I think the gender bias towards females when it comes to aesthetic concerns is not so much there anymore. The lines are being blurred. And many male patients or male young people will seek out care or medical attention for these kind of issues. The best advice you can give someone like that is to consult with a plastic surgeon, to express their concerns, their worries, to say what exactly it is that bothers them, or what they would like changed or reconstructed or operated on, and then to get a full and concise idea of what the possibilities are, what is reasonable to look after that person, and what can be done. And as long as they have a very realistic idea of it, I think that will make a big difference. They'll be given some information in terms of reading material as well, and they'll be pointed in the right direction in terms of websites on the internet as well. And that'll make a big difference to them.